Nehawu is launching its service delivery campaign at the Nelson Mandela Academic Hospital in Mthatha. Their focus is mainly on the health sector and its deteriorating state. Shortage of staff, dilapidating nurses' homes and medico-legal claims are expected to be their main focus. Health MEC Nomakhosazana Meth is expected to attend the march. SABC News reporter Fundiswa, Mhlekude and video journalist Lwandile Mbulali are at the march. A very good morning to you. There are, of course, a number of issues that prompted today's march, particularly what inspired the union to go out to the Nelson Mandela Hospital.
Thank you very much, Desiree. A very good morning and greetings to everyone at home. We are just outside the Freedom Square. We are at Freedom Square right now, where Nehawu is gathering. Nehawu members are gathering for the march because they will be marching from Freedom Square to Nelson Mandela Hospital. We have heard the past week that many patients were turned away at the Nelson Mandela Hospital due to lack of water, and there are also some other electricity issues in some hospitals in the Eastern Cape. As we know that Frontier Hospital was operating on backup generators, and we also know that there are some rural hospitals like Lwandile Hospital and another hospital like St. Barnabas or Islimela in Port St. John's, where nurses' homes are just deplorable, in a very deplorable condition. Logistically, the Nehawu marchers are expected to march from the Freedom Square to Nelson Mandela Hospital, where they'll be handing over their grievances. But with me is Nehawu President, Mr. Mike Shingange. Mike, thank you very much for joining us. Let's start with what exactly do you mean by launching this march, this campaign here in Mthatha?
Well, of course, we're not only launching it here, we're also launching it in Gauteng today. But of course, because the first leg of our public sector campaign, it's anchored around the health facilities. I'm sure it's common knowledge that the Eastern Cape, in terms of the state of the public health, leaves much to be desired. We were here 2 years ago during the COVID-19, wherein we were trying to find about the level of readiness for a public health institution to respond to the pandemics. We compiled the report, we engaged with the ministers, we engaged with the MECs. Today the situation is worse than it was last time. As we were explaining now here about some rural hospitals, what they are going through, including in Nelson Mandela. We spent the past 2 weeks here engaging with workers, engaging with communities, engaging with some authorities here. Now today we are going to be meeting the MEC, where we are going to highlight and show him, including the HOD, what we have found. Because the issue is about the institutions of public service upon which our people rely on to be fit for purpose, so that they are able to deliver quality service to our people. Because more often the public do not know what workers are going through on a daily basis. How long do they have to stand on their feet trying to reduce the queue, but because of the insufficient staffing, they are overloaded, and then the patients sometimes are turned away unassisted. They don't know that there are no facilities that are working, there are no abolition facilities in the hospitals for public and for patients. They don't know that it is not the public servants that have been given the tender to supply the catering, for instance. So when they don't get enough food, they think it's a public servant. And that is why we are highlighting this thing both to the authorities but also to the public, so that together we can hold the government accountable, so that the public institutions are equipped enough to be able to provide service to our people.
And usually the issue is budget. Like the Department of Health, we say we are experiencing budget constraints. Do you believe that?
Well, there's no nation that can sacrifice the health of its society in terms of budget. There's no monetary that you can put on the life of the people, on the kids that are dying in hospitals. There's no money. So we think that health and education have to be down on the list of the budget. It's scandalous. And that's why we're highlighting this campaign at a time before we go for a budget next week. It is our view that the trend that has been coming for the past 7 years that every time there's a budget speech, the department that suffers the cut is health, is education, which is what 80% of our population depends on the public health, not on the private health. They can't afford to go to private hospitals. So we're making this campaign to make sure that it's resourced, fund it, build hospitals proper, build clinics, put management teams, because there are no management in many of the hospitals. CEOs are acting, HRs are acting, and so on and so on. So we hope that by the budget, the minister will think of the health for the population rather than to think of saving money when people are dying.
Mm-hmm. Okay, who are your stakeholders here? Because we are seeing that it's mostly Nehawu. Who else is here?
Well, we've called communities. Yesterday, when we went to some clinics here, we were able to meet the people who are at the receiving end of this service. They are going to be joining us when we go to Nelson Mandela Hospital now. And of course, we're going to be meeting the team led by the MEC and the HOD of the Department of Health there. Of course, we're also going to see the community of the hospitals where there in Nelson Mandela, where we are going, who are not here by now, but we're going to be joining them here. We've got our alliance partners here. We've got the South African Communist Party here. We've got the Federation Ikosato that is with us here, but also in Johannesburg in Charlotte Maxeke Hospital, where we're also launching a similar leg of this campaign.
Thank you very much. Nehawu President Mike Shingange saying that the conditions, especially in rural areas, is far worse than what they saw 2 years ago when they were in this site.